Well, I'm P Yadava. I'm the Chief Cardiac Surgeon and the Chief Executive Officer of the National Heart Institute in New Delhi. Well, cardiac transplant is technically not at all a difficult operation. In fact, an average cardiac surgeon does all elements of the cardiac transplant in bits and pieces. He does aortic anastomosis in an AVR, does pulmonary anastomosis, does right atrial and left atrial anastomosis in various forms, but combining them together in one surgery, that is in a heart transplant, one might not have done. So technically it is not at all a demanding operation. It may become demanding if a patient is having a redo surgery. Then obviously additions have to be taken care of, but even there it is not very serious because you're not bothered about damage to the myocardial tissue or to patent graft because you're in any case going on for a heart transplant. The main issue with the transplant is essentially the procurement, the logistic problems involved in organ donation, in preservation and transfer and transport of that organ to the patient for proper matching of the patient, and subsequently after surgery for ongoing follow-up and surveillance of these patients. But technically it's a simple, straightforward operation.